Welcome back. Our topic today is the lateral ventricle. Before discussing the lateral ventricle as such, I think it would be better if you have an overview of the ventricular system. Ventricles are cavities within the central nervous system within which or through which the cerebrospinal fluid circulates. There are two ventricles, one each in each cerebral hemisphere, called the lateral ventricles. The one you see here, these are the lateral ventricles, one each in each cerebral hemisphere. These lateral ventricles are connected through the interventricular foramen of Monro to the third ventricle, which lies at the midline in between the two thalamus. This third ventricle is connected through the cerebral aqueduct, which lies within the midbrain, the cerebral aqueduct, to the fourth ventricle, which lies in the dorsal part of pons and medulla. So, the cerebral hemisphere, each cerebral hemisphere contains one lateral ventricle each. These lateral ventricles are connected to the third ventricle at the center, which is in turn connected through the cerebral aqueduct to the fourth ventricle. This is the ventricular system. We will see each ventricle separately in separate videos. In this video, we will be discussing the lateral ventricle. The lateral ventricle. As I told you, the lateral ventricles are two in number, one each in each cerebral hemisphere. And this lateral ventricle communicates with the third ventricle through the interventricular foramen of Monro. We will need a diagram to discuss the parts and other features of lateral ventricle. We will do that now. Coming back, first we will see the parts of the lateral ventricle. The lateral ventricle, each lateral ventricle is divided into four parts. The central part or the main body of the lateral ventricle, the anterior horn which lies in front of the interventricular foramen of Monro within the frontal lobe of the cerebral hemisphere, the posterior horn which lies in the occipital lobe of the cerebral hemisphere, and the inferior horn which runs into the temporal lobe of the cerebral hemisphere. So, four parts: the central part, the anterior horn, the posterior horn, and the inferior horn. This is a view from above, that is superior view. Again, the central part, the anterior horn in the frontal lobe, the posterior horn in the occipital lobe, and the inferior horn running into the temporal lobe. Now we will see each part separately. first we will see the central part. For that we will draw a section of central part at this level and weave it. Now this is the section of the central part of the lateral ventricle. As I told you, it extends from the interventricular foramen to the splenium of corpus callosum. You will see the boundaries of the central part. The roof of the central part here, what you see here is the central part of the lateral ventricle. The roof of the central part is formed by corpus callosum. The medial wall is formed by septum pellucidum and body of fornix. The floor of the central part is formed by the body of the caudate nucleus, stria terminalis, thalamostriate vein, the thalamus, the choroid plexus, and of course the fornix. Now we will have to add a note on choroid fissure. The choroid fissure is the line along which the choroid plexus, the choroid plexus is a plexus of cells which produces the cerebrospinal fluid. The choroid fissure is the line along which the choroid plexus invaginates the lateral ventricle. This choroid fissure extends from the interventricular foramen around the thalamus up to the uncus. Okay. So choroid fissure is a line along which the choroid plexus invaginates the lateral ventricle, and this extends from the interventricular foramen around the thalamus up to the uncus. In the central part of the lateral ventricle, the choroid plexus invaginates the narrow gap between the fornix and the thalamus. In the central part of the lateral ventricle, the choroid plexus invaginates the narrow gap between the fornix and the thalamus, and it is this narrow gap between the fornix and thalamus which is called the choroid fissure. Okay, now we have finished the central part. We will see the next part, that is the anterior part. We will take a section at this level and weave it. This is the anterior horn, the section of the anterior horn of the lateral ventricle. It is the portion of the lateral ventricle which lies in front of the interventricular foramen within the frontal lobe, and in section it is triangular in shape. It is triangular in cross section. Coming to the boundaries of anterior part, the anterior part is bound anteriorly by the genu and rostrum of corpus callosum. The roof is formed by the anterior part of the body of corpus callosum. The floor is bound by head of the caudate nucleus and rostrum of corpus callosum. Now we are coming across this corpus callosum and its parts like genu, rostrum, splenium. So much in this topic. So you might be wondering what those are. We will be having a separate video class on white matter of cerebrum, including the corpus callosum, in some other video. But for the time being, in order to avoid the confusion, I will just give an overview what this corpus callosum is. The corpus callosum is one of the commissural fibers which connects the two cerebral hemispheres across. The one here, okay, this one is the corpus callosum, and it is a commissural fiber which connects the two cerebral hemispheres across, and it has four parts: the rostrum, the genu, the body, and the splenium. It is this corpus callosum and its four parts we are coming across again and again in the lateral ventricle topic. Our lateral ventricle lies just below the corpus callosum. So the corpus callosum forms the roof of the lateral ventricle. The anterior part of the lateral ventricle lies about here. So the genu and rostrum forms the anterior boundary. The rostrum also forms the floor of the anterior part of lateral ventricle. The roof of the central part is formed by the body of the corpus callosum. Okay. So we will be discussing corpus callosum in detail in some other video, but for the time being, just know what is corpus callosum and its parts. Now let's go back to our original topic, that is the lateral ventricle. So as we saw there, the anterior part of the lateral ventricle is bound anteriorly by genu and rostrum of corpus callosum, the roof by anterior part of the body of corpus callosum, the floor by head of caudate nucleus and rostrum of corpus callosum. The medial wall is bound by the septum pellucidum and fornix. The medial wall of the anterior part of the lateral ventricle is bound by septum pellucidum and fornix. Now let's move on to the next part, that is the posterior part. We will draw a section of the posterior part at this level. This is the section at the level of posterior horn. The one you see here is the posterior horn. Posterior horn lies behind the splenium of corpus callosum in the occipital lobe. Coming to the boundaries of the posterior horn, the floor and medial wall. The floor and medial wall is bound by forceps major and calcarein sulcus. The floor and medial wall is bound by forceps major and calcarine sulcus. The forceps major forms a bulging in the posterior horn called the bulb of posterior horn, and the calcarine sulcus makes a bulging called the calcar avis. The roof and lateral wall. The roof and lateral wall is bound by tapetum. So now you might be wondering what this forceps major tapetum mean. Okay, they are the fibers within the corpus callosum. The forceps major, forceps minor, rostrum, tapetum. These are the fibers within the corpus callosum. We will be having a detailed class on corpus callosum later on. For the time being, just know they are fibers within corpus callosum. So the roof and lateral wall is bound by tapetum. The floor and medial wall is bound by forceps major and calcarine sulcus. Now coming to the cross section of inferior horn, we'll draw the cross section of inferior horn. Is the section at the level of inferior horn. The one here is the inferior horn. The inferior horn extends from the junction of the central part and posterior horn into the temporal lobe. It extends from the junction of the central part and posterior horn of the lateral ventricle into the temporal lobe. The boundaries here are the roof and lateral wall. The roof and lateral wall is bound by tapetum, tail of caudate nucleus, stria terminalis and amygdaloid body. The floor is bound by the collateral sulcus, forming the collateral eminence in the inferior horn and the hippocampus. The floor is formed by the collateral sulcus, forming the collateral eminence of the inferior horn and hippocampus. With this, we will end our class on lateral ventricle. The clinical anatomy part is yet to be covered, but I will do that at the end of the class on third ventricle. We will cover the third ventricle and do the clinical relevance part of both together. Okay. Most probably my next class will be on third ventricle. Until then, thanks for watching.